Hello, my name is Seinen and I'm a last year medical student at the University of Groningen in the Netherlands. I'm in my differentiation internship at the Department of Urology of the Isala Hospital in Zwolle, and today I will talk about the research we performed which focuses on the treatment of overactive bladder syndrome in female patients. I have no potential conflict of interest to report, and the study is funded by our own institution. Current treatment guidelines for overactive bladder advocate a linear patient pathway based on treatment invasiveness, but in daily practice, effectiveness and side effect tolerance may differ among patients. Besides that, it can take weeks to months for the effects of treatment to be evaluated adequately. Together, these features mean that the current treatment algorithm may not produce a quick reduction in symptom severity for many patients, leading to impaired quality of life and additional costs. In this study, we aim to provide real-world data on the overactive bladder patient pathway from diagnosis to final treatment with a satisfactory response. We analyzed the overall effectiveness of overactive bladder treatment focusing on the following 5 questions. Which treatments were offered? How many treatment steps were offered? What was the duration of each individual treatment? Which patients achieved satisfactory response to each treatment? And what led to treatment discontinuation? We performed a single-center retrospective cohort study in which we enrolled patients referred to the outpatient urology clinic of the Isala Hospital Zwolle in the Netherlands. We included only female patients who were at least 18 years old and had no other pathology that could explain the overactive bladder symptoms. Follow-up ended when a patient experienced satisfactory response or on January 1st, 2020. We defined successful treatment as satisfactory reduction of symptoms with no need for further treatment. When patients received combinations of treatment, we only reported the combination that occurred at least 10 times. We also created a Sankey plot with display R to visualize the sequence of treatments. This table shows the patient characteristics. We enrolled a total of 120 patients with a mean age of 58. 67% of the study population suffered from obesity. This slide shows you the Sankey plot we created. This plot gives a unique insight of the sequence of the offered therapies. As you can see, the offered treatments are very diverse. All treatments for overactive bladder were available, and some patients needed up to 6 treatments. Patients needed a median of 2 treatments, and medication was most often the first treatment, a single therapy or in combination with pelvic floor muscle therapy or percutaneous tibial nerve stimulation. This table shows the duration for each treatment. The duration of treatment differs among the treatments. For example, medication took 8 to 9 weeks, while percutaneous tibial nerve stimulation was evaluated after 12 weeks. The total median treatment duration was 28 weeks. In our study, treatment with botulinum toxin A injections was the most effective treatment. The most common reasons for discontinuation were side effects and insufficient response. So our study revealed 2 important conclusions. First, most women need to try at least 2 treatments before they experience satisfactory symptom relief. Second, treatment evaluation takes time to allow for different onsets of therapeutic effect, which vary by patients and treatment. We think that these findings are relevant to clinical practice and could help to manage treatment expectations by clinicians and patients alike. Thank you for your attention.